All right, we are going to go over the clavicle and where some of the muscles originate and insert on it. So if we look at this, we can orientate ourselves. This is the sternal end of the clavicle, more proximal, and this is the acromial end of the clavicle, more distal, and you can tell because this is the flat end. So if we look at this red portion here, we can see that it's more proximal towards that sternal end. This is actually where the pectoralis major originates, or one of the parts that it originates at. And if we go more distally on this distal third towards the acromial end, this is where the anterior head of the deltoid originates. If we flip the clavicle over, we can see on this more acromial distal end, on the dorsal side, we can see the insertion point for the trapezius muscle. And then if we flip this to the underside on this inferolateral portion, this is where the subclavius inserts, as well as the clavipectoral fascia. And that is the painted clavicle bone. All right, so now we're going over the scapula. So we can tell that this is the left scapula because we know that the glenoid points laterally, and then we can see the spine here, so we know this is the posterior side. So looking at it posteriorly, we can see it's pointing towards the left, so we know that this is the left scapula. Going over some of the origins now, we have the supraspinous fossa for the origin for supraspinatus, infraspinous fossa for the origin for infraspinatus. We have this lateral border, posterior lateral border here for the origin for teres minor. Inferior angle, we have the origin for teres major. Looking at this spine of the scapula and wrapping around to the acromion process, we have the origin for the posterior and lateral heads of the deltoid. Looking laterally now, we can see the glenoid and the supraglenoid tubercle, which is the origin for the long head of the biceps brachii, and the infraglenoid tubercle, which is the origin for the long head of the triceps brachii. Looking anteriorly, now we can see the subscapular fossa for the origin for subscapularis, and we can see on this coracoid process we have the origin for two muscles. Those are coracobrachialis and the short head of the biceps brachii. Now going over some of the insertions. Also on this coracoid process we have the insertion for pectoralis minor. We have on this anterior medial border of the scapula the insertion for serratus anterior. Looking posteriorly now, we can see on this superior angle of the scapula, we have the insertion for levator scapulae, and we have two insertions here on this medial border of the scapula. So inferiorly we have rhomboid major, and superiorly we have rhomboid minor. And right on the top of this spine here, we can see the insertion for trapezius. And that is the scapula. All right, so now we're going over the humerus. So you can tell that this is the left humerus because we can see the trochlea and the capitulum. So that we're looking at the anterior side, and we know that the head is facing towards the medial, so we can know that this is the left humerus. So looking at some of these insertions and origins, we can see that this is the lesser tubercle right here, where the subscapularis inserts. And then on this side, we can see the greater tubercle, where on the superior side, the supraspinatus inserts, and on the posterior side, the infraspinatus and the teres minor inserts. Looking at the anterior side again, we can see this bicipital groove where on the lateral lip, the pectoralis major inserts, as well as on the medial lip of the inferior bicipital groove, the latissimus dorsi and the teres major inserts. Looking more inferiorly now, we can see the deltoid tuberosity where the deltoid inserts, as well as medially where the coracobrachialis inserts on this medial central diaphysis. Now looking at some of the origins for some muscles. On this anterior diaphysis, we have the origin for the brachialis. And looking more laterally on this lateral supracondylar ridge, we have the origins for brachioradialis and extensor carpi radialis longus. And looking at the lateral epicondyle, we have the origin for the common extensor origin as well as the origin for Anconius. And looking at the medial epicondyle, we have the origin for the common flexor origin as well as the origin for pronator teres. And now looking at the posterior side, we can see this radial groove right here. On the superior side, superior to the radial groove on the posterior side of the humerus, we have the lateral head of the triceps brachii, and inferior to the radial groove on the posterior side of the humerus, we have the medial head of the triceps brachii, and that is the humerus. All right, so now we're looking at the radius. So we can tell that this is the left radius because the styloid is also always facing laterally in anatomical position, and we can also see this radial tuberosity. So we know that this is the anterior side. So looking at some of the origins for the radius, we can see on this anterior surface of the radius, and also on the interosseous membrane is where flexor pollicis longus originates. And looking at the back of the radius, the posterior side, here on the middle posterior radial shaft and on the interosseous membrane, we have the origin for abductor pollicis longus, and more distally on the posterior radial shaft and interosseous membrane, we have the origin for extensor pollicis brevis. So now looking at some of the insertions here, we have the radial tuberosity where biceps brachii inserts. Here on this proximal third of the clavicle, the supinator wraps around and inserts. And right below it on the oblique line of the radius, we have the insertion for pronator teres. Looking at this anterior distal surface of the radius, we have the insertion for pronator quadratus. And right here on this styloid process, we have the insertion for brachioradialis. And that is the radius. All right, so now we're going over the ulna, and we can tell that this is the left ulna because we can see this radial notch right here, and we know that the radius sits laterally to the ulna. So since this radial notch is on the lateral side of the ulna, we can tell that this is the left ulna. Going over some of the origins and insertions now, we can see right on this supinator crest, we have the origin for supinator. Right under this coronoid process, we have two muscles originate, and those are pronator teres and flexor digitorum superficialis, right under this coronoid process. Looking at this anterior shaft and wrapping around to this posterior side of the ulna, and also originating on the interosseous membrane, we have the origin for flexor digitorum profundus. Moving distally on this distal anterior surface of the ulna, we have the origin for pronator quadratus. And now looking at this posterior part of the ulna, we have three muscles that originate here, and also they all originate on the interosseous membrane. So going over them proximally to distally, we have abductor pollicis longus, extensor pollicis longus, and extensor indicis, all originating on this posterior part of the ulna and the interosseous membrane. Now going over some of the insertions, right on this coronoid process here, we have the insertion for brachialis. Right on top of this olecranon process, we have the insertion for triceps brachii. And on this lateral part of the olecranon process and going down to the posterior border of the ulna, we have the insertion for the Anconius muscle, and that is the ulna.